Hi, I'm Jure Baloh and I'm Assistant Professor of Health Policy and Management here at the UAMS College of Public Health. And my introduction to addiction, health services research and addiction research came through the T32 experience. I was really fortunate that they took me without background in addiction. My training was in health services research. And it allowed me to explore the topic of addiction through the health services lens. So how do we organize and provide treatment, and particularly how do we implement new evidence-based treatments to help advance the quality and outcomes of people in addiction treatment. And it just allowed me to interact with many people on campus and later on also off campus that work in this area along the entire translational spectrum, from people doing work, with mouse models all the way to the public health end of the spectrum where I work, and understanding that pipeline, the different decisions people make, the questions and issues they grapple with, and what it means by the time we receive what are called evidence-based treatment, proven clinically effective in rigorous trials, and then our task is to get those out to as many people as possible. But understanding the entire pipeline really helped me understand our work better, what we call implementation science. How do we take those findings and translate them into everyday routine use? Simultaneously, it all being new to addiction, it also allowed me to understand the organization and the system of addiction treatment better, and how it differs from the rest of the healthcare system, which really speaks to me and my background in health services and policy and organization. And it allowed me to understand that it is really a different system, that assumptions I've made about the healthcare system studying hospitals didn't hold in these often resource constrained community settings, the additional difficulties they have because of policy and funding issues, staffing and turnover issues, and other things that often escape people that focus on the clinical side only, unless they also happen to work in that environment and then experience it as being part of the system. But in our position, we're allowed to step back and learn about it more holistically, and then to study and perhaps develop interventions or other policy solutions perhaps to help improve that system. And over the years, both during my T32 and subsequently, I have been fortunate to have funding to continue my additional work in addiction. I grew to appreciate the complexity and the nuances of the system, and it all started with that opportunity I had as a T32 scholar. And last but not least, the T32 connected me with wonderful people on campus, many of which I continue to call and refer to as my mentors, my friends and colleagues. And we have a very rich and diverse community of scholars working in addiction here on campus, many of them connected through the T32 program. And it just allows for a very stimulating and academically and interdisciplinary and rich conversation and interactions that we can have just on an ongoing basis. But then, of course, this provided also the grounds to then further interact with people nationally and internationally and learn from them, and just, again, grow professionally through that. And I couldn't have done that without the T32 experience.